Hello, Dr. Mark Dailey here. Today we're going to talk about the adrenal stress index. What this is it's a saliva test that we do to assess the adrenals. I'm going to cover some of the reasons why this test may be of value to you. Ultimately, the decision is yours. We're going to ask why evaluate the adrenals, and there are three compelling reasons. The conceptual and the practical reasons for having the adrenal stress index panel performed are real simple and easy to understand. Consider that all living creatures are subject to stressors of internal and external origins. That means we have internal stress if we have disease, viruses, parasites, bacterial dysbiosis that creates a stress that's internal. And then we have external stress, which is perhaps your job or relationships or just life events. Also, all living creatures respond to these stressors. When they stop responding, they're usually dead, and humans are no exception. The human stress response is a well-defined series of reactions of the tissues, organs, and organ systems. Many aspects are quantifiable, which means they can be measured. Therefore, through measurements, we can learn to modify and manage the stress response intelligently. The basal stress response, or the normal stress response of the human beings, demonstrate a predictable change in values over a 24-hour period. They are rhythmic with slight variations, so they're high in the morning and low night values. Now, let's just talk a little bit about the adrenal glands. I'm not going to give you an anatomy class, but I want you to understand a few things. The adrenals are two small glands, each weigh about 3 to 5 grams, that are located above the kidneys. The adrenals have one of the highest rates of blood flow per gram of tissue and the highest content of vitamin C per gram of any tissue in the body. Each adrenal gland is composed of two separate functional entities. The outer zone, or cortex, which accounts for 80 to 90% of the gland and secretes adrenal steroids, cortisol, and DHEA, and aldosterone, and small amounts of sex hormones. The inner zone, or the medulla, comprises 10 to 20% of the gland and secretes catecholamines, which are adrenaline and noradrenaline, also known as epinephrine and norepinephrine. Cortisol, DHEA, and adrenaline are the three main adrenal stress hormones. Now, the human adrenal gland does not secrete its steroid hormones at a constant level throughout the day. The hormones are actually released in a cycle, with the highest value in the morning and the lowest value at night. This 24-hour cycle is called the circadian rhythm. An abnormal adrenal rhythm can influence many functions of the body, some of which I'll mention now. The energy production. Abnormal adrenal function can alter the ability of the cells to produce energy for the activities of daily life. People who have a hard time rising in the morning or who suffer from low energy throughout the day often have abnormal adrenal rhythms and poor blood sugar regulation. The maintenance of a stable blood sugar level depends on food choice, lifestyle, adrenal function, and insulin activity. The adrenal stress index panel measures stress hormones and insulin to help ferret out the cause of fatigue, cravings, and obesity. Now, we talk about muscle and joint function. Abnormal adrenal rhythms are known to compromise tissue healing. Reduced tissue repair and increased tissue breakdown can lead to muscle and joint wasting with chronic pain, which so many people suffer from this day and age. Bone health. The adrenal rhythm determines how well we build bone. If the night cortisol level is elevated and the morning level is too high, our bones don't rebuild very well, and we're more prone to osteoporosis. Stress is the enemy of the bones. In postmenopausal women, the effect of stress worsens due to female hormonal imbalances. Now, immune function. Various immune cells, white blood cells, cycle in and out of the spleen and bone marrow. The immune system trafficking follows the cortisol cycle. So if the cycle is disrupted, especially at night, then the immune system is adversely affected. Then short and long-term stress is known to suppress the immune response in the lungs, the throat, urinary tract, and intestines. With the reduction in the surface antibody called secretory IgA, and I may have talked to you about this before, the resistance to infection is reduced and allergic reactions are believed to increase. And then sleep quality. In sleep-deprived individuals, the mean cortisol levels are elevated and the period is shorter. Evening cortisol level is increased in patients with insomnia, affecting the first part of the nocturnal sleep period, increasing risk for depression. And then fertility. Couples with high levels of stress markers are less likely to succeed in conceiving. Stress alters the brain signals that trigger the ovaries to release eggs every month. So women under non-stop stress ovulate fewer eggs than less stressed women. Stress can also affect testosterone levels and sperm production in men. Helping couples to de-stress while trying to conceive can impact their success rate. Then memory. Sustained stress adversely affects brain function and memory processing. Too much cortisol interferes with the functioning chemicals the brain uses for its intercellular communication. Chronic long-term stress with increased cortisol levels at night makes it perplexing to think, organize, and store new memories or retrieve long-term memories. And then how about skin regeneration? Human skin regenerates mostly during the night with higher cortisol values. Less skin regeneration takes place, so a normal rhythm is essential for optimal skin health. And then thyroid function, which is such a big issue for women and men alike. The level of cortisol at the cell level controls thyroid hormone production. Often hypothyroid symptoms such as fatigue and low body temperatures are due to adrenal maladaptation. Grain intolerances and stress responses. Approximately 12% to 18% of the U.S. population suffers from a genetic intolerance to grain. A high incidence occurs in people with Celtic, Nordic, non-Caucasian, and Mediterranean ethnicity, easy for me to say. The gut becomes inflamed within 30 minutes after consuming grains, and this can lead to an adrenal stress response, increased cortisol, and reduced DHEA. Now let's cover, as we come to a close, the advantages of the ASI. The test is non-invasive, and it can be performed wherever you are. Saliva is collected under real-life conditions. There are no stressful blood draws, no gallon-sized urine containers to carry around for 24 hours. With blood and urine testing, a number of borderline adrenal conditions are missed due to lack of sensitivity. This is not the case with the adrenal stress index because samples are taken within one circadian cycle and the more definitive free fraction is measured. The ASI is an in-depth test such that options for treatment are increased significantly over the serum or blood and urine test results. Abnormal adrenal rhythm can influence energy production, bone health, immune system health, sleep quality, skin regeneration, thyroid function, muscle and joint function, fertility, and memory, which we've just covered. The Adrenal Stress Index panel can explain excessive feelings of tiredness and inability to cope, which so many people have. It can help your physician, like myself, understand how to eliminate cravings for excessive calories and help build and maintain muscle mass. It can reveal the strength of your immune system, help you to reduce chronic stress by avoiding food allergens, can help you balance blood sugar by following a balanced diet, chronic stress and related health problems, lack of vitality and energy, muscle and joint pain, hypoglycemia, migraine headaches and general headaches, osteoporosis, sleep disturbances, poor memory, alcohol intolerance, irritability, low sex drive, which is an issue for many people today, low body temperature, and poor cognitive function. Now, if reaching optimal health is your desire, the ASI test may be part of your answer. I want to thank you so much for your time and your attention. God bless. Have a great day. If you have any questions, feel free to call our office.